All right, here we go. So now I want to welcome everybody who showed up today for our every other week event of Therapy Thursday, brought to you by UNC Therapy Services and the Community Engagement Committee. Very excited to have all of you here today. We really enjoy putting on this program. I think it's fantastic to be able to reach out to the community in this fashion at this time, where we really can't have a hands-on program with too many people because of COVID, but we can still reach out and give people information and really share the knowledge that we have to really keep engaged with everybody out there. So thank you for coming to us. I know it's an extra step to actually get you to get online and come to attend this. So we appreciate you making the effort. So thank you. Today our topic is going to be plantar fasciitis. What the heel? This was a request of a topic that came in a couple months ago, and we found the perfect guy to talk about it for you today. So Christopher is a physical therapist here. He works primarily at the Spine Center, treating spine conditions, orthopedic issues. He is a board-certified orthopedic specialist, and he's done some extra research and presentation on plantar fasciitis. So I'm really excited for what he's going to bring to the table today. As we're going through here, if you have any questions, please feel free to put them in the chat. And I'll be monitoring that as we go. If it's something urgent that you want answered, you can urgently chat, but otherwise we're going to try to save the questions for the end. And after this is over today, I will have this posted up on our YouTube channel, which I will share the link as well. And what else? If you want to get a copy of the slides from today, then at some point you can send me privately a chat. If you don't want to share your email with everybody, you can just chat me personally. My name is Evan. I don't know if I did that already. Hi, Evan Adler. Nice to meet you. And then I'll make a list of those and I will send it out to you later on. Okay, so without further ado, I'm going to introduce Christopher. Christopher, it's all yours. Take it away. I'm going to stop sharing my screen, and you can jump in and share yours. Oh, great.
Right. Thanks so much, Evan. Yeah, really excited to be here to present for you all today. I see some familiar faces and some not familiar faces, so welcome to everyone. And I want to start with a bit of interactivity. It's going to take me just a second to get my PowerPoint in order here. So jump in that chat box, and I want to know from you just right off the bat, have you ever dealt with plantar fasciitis? Do you know somebody who's dealt with plantar fasciitis? And let's see. Okay, let me get my chat box going so I can see what everybody is saying, and then we'll get rolling here. Chat, here we go. Okay, so it looks like quite a few people have some experience with that. So as Evan told you, my name is Christopher Green. I'm a physical therapist at UNC. I work at the Spine Center. I have treated a lot of plantar fasciitis before, and that is the topic of today's talk. So if you're anything like me, when you come to one of these presentations, you're kind of wondering, who is this person and why should I listen to them? So Evan let you know I'm a board-certified clinical specialist in orthopedic physical therapy. I'm actually a published author on plantar fasciitis, but most important, I have had plantar fasciitis also, and I have survived it. So I'm here to help you with that today. And I want to start just with kind of my story, plantar fasciitis. So back when I was in graduate school at LSU, I decided I was going to get on a health kick, and I was going to run 4 miles every day and really just get after it. And my second day of running, I got about 2 miles in, and man, I stepped on a rock, it went right through my shoe. It was the worst pain I ever felt, and I immediately went down on the ground, took off my shoe, immediately, expecting to find blood and just a gory event. And there was no rock, there was no blood, there was nothing in my shoe. And I thought, what the heel? Well, why is this happening now? Why? I have this health kick, and this other graphic I have up here is a couch to 5K plan. It would have been great if I would have researched something like that, but I just went out there and started running. I just wanted to share that little personal story and how that kind of relates to my presentation. We'll see as we go along here. So objectives for today, I really just want to help you kind of understand, demystify what the plantar fascia is, what happens when it gets irritated or when you develop plantar fasciitis, teach you some effective self-treatments that you can do at home. We'll go through some effective things that you can start doing right away. And if you do need a little extra help, I can let you know what physical therapy can offer in that regard. And finally, we'll go through some preventative measures. So hopefully if you don't have it or you've had it before and you want to prevent yourself from getting it again, we'll go through that also. So starting out, what is the plantar fascia? Well, the plantar fascia, any fascia in the body is a dense connective tissue. One of the hallmarks of this tissue is it has very poor blood supply, and that's going to have some implications for healing that we're going to discuss later. So a role of the plantar fascia is that it kind of connects the heel to the toes. So you see the cartoonish picture there, if you can see in my tiny little box, kind of goes from the heel of the foot to the metatarsal heads, which is kind of right at the base of the toes there. So that's where your plantar fascia is. And then if you haven't experienced plantar fasciitis, I'm very envious of you, but plantar fasciitis is typically an overuse injury. It can also be a degenerative irritation of that fascia, that band of tissue down there, either in the heel or the arch. And it can be very painful, and it can be chronic, or it can resolve pretty quickly if you get the right treatment. So plantar fasciitis it's a big problem. 2 million Americans per year suffer from it. About 10% will seek treatment in their lifetime. And on the surface, 10% doesn't sound like too big of a deal, but that's about 33 million people. So this is something that we see a lot in physical therapy, especially among runners, but even people who are non-athletic can develop this for a variety of reasons. And then for my runners who are on the call, about 8% of all running injuries are plantar fasciitis. So this is something worth discussing, and let's get right into it. So the roles of plantar fascia is it kind of supports your arch and weight bearing. So again, if you can come up into my window here, whenever you're bearing weight through the body, it's going right through your shin bone there. So this is the front view of the foot, the weight's going through, and if you see from the side there, all your weight is being transferred through that arch in your foot. And as you see on the screen here, the plantar fascia can kind of help resist that collapsing of the arch. And what happens whenever you get ready to run or take a stride and your leg is about to advance forward, the toes dorsiflex or extend, and it actually kind of tightens that plantar fascia up and then raises the arch. And so that really prepares your foot to move in an explosive way forward. So the plantar fascia, it's very important in the gait cycle, whether it's walking or running. And we really need a lot of range of motion in the toes, as we'll discuss later too. That's going to be really an important part. So here's a basic gait cycle when you're running. You can see kind of the different demands of the ranges of motion here. What I want to draw your attention to is number 3. So you see right here during mid stance, and that leg is starting to advance forward over the ankle. That places a big demand of ankle dorsiflexion, which is this motion. If you're laying on your back, you try to bring the toes up towards your nose. That's dorsiflexion there. So the opposite of pointing your toes, it's bringing the toes towards you. So whenever you're running, the leg advances over the foot. You need that range of motion there to advance the foot. And then right when you're getting ready to take the toe off, those toes have to really bend. In number 4, right, the toe off. So you can see the demands right away on the ankle and the big toe there. So if those aren't working properly, we're going to start to put some strain on the plantar fascia. So some symptoms of plantar fasciitis. First, step pain is probably the most common symptom that we see. People often describe it as stepping on a Lego or a bear trap. Either way, it's really not comfortable at all. It can be a little bit confusing in that as you get walking throughout the day, you get more blood flow down in that area and it can desensitize a little bit, and it actually starts to improve with walking. So you might think, oh, well, maybe I just, had a small injury, but now it's getting better. And then at the end of the day, it's going to let you know that it hasn't gone anywhere. It's still there. So after being on your feet all day and putting more weight through that foot and the plantar fascia, it can kind of get irritated again. So most often there's tenderness at the heel where the plantar fascia inserts. So not directly under the heel, that's kind of where a fat pad is, but just a little bit further towards your toes, the heel. And you can feel it really anywhere from that heel all the way through the arch into the toes. So when I felt it, when I experienced it, I felt mine right in the center of the arch, but oftentimes you feel it right back there in the heel as well. So some causes and risk factors for plantar fasciitis. A sudden increase in training is really the hallmark of what we see with this. So don't be like me and try to run 4 miles every day right away. But we often see that people who do a lot of activity, whether it's hiking or running or even walking, just what your tissues aren't used to, it can be a little too much for that to happen. Moving on to limited ankle and toe range of motion. I just went through that gait cycle with you. You can tell if either of those two things are restricted, you're going to start to put a lot more pressure on the plantar fascia. When you're barefoot, you don't have any support from shoes or anything to kind of take on the brunt of that pressure going through your foot. So if you've been at the beach and you've been walking around in sandals or bare feet on the sand a lot and you come home with that kind of stabbing pain in your arch or your heel, that might be an indicator that your plantar fascia is irritated. For footwear, we're going to get into that into a little bit more detail later in the presentation, but footwear that doesn't really align with your foot structure or old footwear that doesn't give you enough support, that combined with too much training can cause plantar fascia. And finally, being overweight, having a higher BMI, or even just external load. So let's say you're going on a big camping trip and you have a big weight on your back. If we just think of the physics of it, anytime you have more weight coming down through the arch here, it's going to put a lot more pressure on that band of tissue going across. So these are kind of the most common indicators or risk factors that we see with plantar fasciitis. So now I want to go through some treatment with you guys. First, we're going to focus on putting out the fire, and then we'll go through some self-treatment techniques. Like I said, some things you can try right away at home to try to get this thing under control. And then we'll just briefly discuss some things in physical therapy that can be helpful if what you're doing at home isn't getting the job done. So number one, putting out the fire. Ice water bottle massage is a really effective way to kind of handle the acute pain for this condition. So what you do is take any water bottle, normal size, just dump about a quarter of it out and throw it in your freezer. So when you freeze it, that bottle is going to expand and you don't want it to blow up. So pouring a little bit of water is helpful there. And you can put it under the arch of your foot, like in this picture here. Just kind of roll it, massage. You can do that 3 or 4 times a day for about 5 to 10 minutes. That ice will help kind of calm some of the inflammation down, and the massage can kind of work on the tissues. It's important to note this isn't going to solve anything with the plantar fascia. It's more of a pain relieving in the moment. So if you're just having a really tough time and you need to address the symptoms right away, this can be beneficial, but this isn't going to be a viable treatment on its own to fix everything. Sorry about that. Also, night splint, the latest evidence for plantar fasciitis and my own personal experience as a clinician, having a dorsiflexion night splint wearing for the first month or two can really help with that first step pain. So whenever you're sleeping, your leg kind of goes into that natural pointed toe position, and that really pulls on the Achilles tendon and the plantar fascia and tightens things up. So what these splints do is it keeps you at least in a neutral dorsiflexion or even a little bit further up, and it can help keep those structures stay a little bit looser isn't the right word. Keep the wrong structures from getting tighter while you sleep. So right away, if you're having difficulty, you can use the ice water bottle, you can use the night splint, and those things should start helping with the pain right there in the beginning. So some self-treatment ideas here. I'm going to take you through some stretches that can be really helpful. We'll touch briefly on footwear and orthoses, also commonly known as inserts, and kind of how to choose the right thing for you. So some stretching exercises. If you are a runner or have ever run or have ever known anybody that's a runner, you've probably seen them do this stretch. It's commonly known as the runner stretch, but what this is doing is stretching the calf here and working on that ankle dorsiflexion range of motion. So some cues for this exercise is you just want to face a wall, put your hands up there for support. Having the foot with plantar fasciitis a little bit further back, and then leaning forward to get a stretch there with the knee straight. You want to keep both of your feet pretty straight during this. If you tilt it out one way or the other, you're not going to get as an effective stretch on that kind of calf complex. And then the dosage for this would be about 3 sets of 30 to 45 seconds, repeated throughout the day, especially if you're actively dealing with plantar fasciitis. You really want to start to improve the length and extensibility of these tissues. So that dosage, 3 times 30 to 45 seconds, that's about the minimum amount of time needed for tissue deformation. So that's really a minimum. You want to hit at least that amount of time for this to be effective. And moving on here, we have basically the same stretch, but with a bent knee. The directions are all the same, except you're going to bend that knee. You might need to slide that foot forward just a tad. And what this is going to do is put a little bit more bias on the soleus with an attachment that's a little bit lower down in the Achilles and the back of the heel. And it's just making sure that we're hitting all of our bases, getting those structures to move a little bit better and getting that ankle to improve with range of motion. So as Evan said before, these slides will be available if you want to come back and reference these a little bit more carefully, go through them, they'll be here for you. Moving on, this is a nice catch-all treatment that we use in clinic, and it's efficient in that it stretches the plantar fascia and the calf muscles. So it's a similar setup again to where you're facing the wall, except here the key is we're going to put a towel rolled up just underneath the toes. And this can be a bit tricky to set up. You really want to get it under the toes and not under the ball of the foot. Because as we talked about with that wind loss mechanism in the beginning of the presentation, getting it right under the toes is going to get that stretch for the plantar fascia there to be able to withstand that load a little more and to improve the range of motion of the toes. So you should feel this stretch back here in the calf and then also in the arch of your foot there. Similar dosing for this, about 3 sets of 30 seconds. And then finally, sitting down, a plantar fascia specific stretch. You just grab the toes with your hand and pull them back towards you. And it can actually be nice to take this offhand and to give yourself a little bit of a self-massage there. That can kind of break up some adhesions in the tissue, stimulate blood flow there. So that's a nice way to really work on that plantar fascia and that toe range of motion specifically. Again, 3 times 30 to 45, 60 seconds. It's going to feel like a long time when you're doing it, but again, you really need that time under tension for the tissues to deform and for it to be an effective stretch. So one of the most common questions that I and probably all physical therapists get asked with plantar fasciitis is, what shoes should I wear? And there's a lot of options out there, and there's a lot of different considerations for this. So I want to touch briefly on some things that I think are very helpful, and then if there's any questions at the end, we can maybe expand on it then. But one of the problematic things we see with footwear with women is high heels. It's just going to put a lot more stress on the plantar fascia. You're going to be kind of in an elongated position, putting stress there. And then with men, hard-soled dress shoes. So it doesn't have a lot of force attenuation at the bottom. Whenever you're walking throughout the day, you're not getting a lot of support in that plantar fascia. So those are kind of the 2 problematic footwears that we can use. But now that you know what you shouldn't wear, I'm going to finally just end the discussion once and for all and tell you exactly what you need to wear. And so the answer is, it depends. And it really depends on the shape of your foot and a few other factors, but right now I just kind of want to focus on on the arch size of your foot. So if you have a high arch, there's some considerations that are going to be a little bit different than if you have a flatter arch. And a good way, if you're not sure which one you have, right when you get out of the shower and you take that first step on the bath mat, or let's say you're at the beach and you're walking in the sand. If you can see a real full imprint of your foot on that bath towel or in the sand, chances are you have a flatter arch, right? And then if you only see just barely the outline of the foot and not so much of the arch, you probably have a higher arch, and you might be somewhere in between, but there's some special considerations for each of these on the outer ends. So for a high arch foot, there's already going to be a restricted range of motion there. So as we talked about before with the wind loss mechanism, whenever the toes bend a little bit, it raises the height of the arch. If you're starting out with a higher arch already, you're already going to be a little bit limited with that range of motion. So putting extra, the temptation is to get a shoe with more arch support to fill in that space. That actually puts more pressure on that plantar fascia. So if you think of a band down here and then you're smushing that band up into the arch, your foot's not going to appreciate that. So for these individuals, you actually want a neutral shoe with a fair amount of cushion. And that's going to help attenuate the ground force. What I mean by that is it's just going to absorb the shock of the ground as your foot strikes it, and your plantar fascia won't have to take as much of the brunt of that. These individuals could also consider a little bit of a higher heel. So in the shoe industry, you call that a heel drop, and that's the size of the rise of the heel versus the toe. And somewhere between an 8 and 12 millimeter toe or heel drop for the higher arch can really help with that. So for the flat-footed individuals out there, you do need some arch support. In this case, if you look straight on from the foot here and the arch is collapsing inwards, you actually need a little bit of support there to help keep that plantar fascia from flattening out too much the other way. So higher arch, don't emphasize the arch support. You want a more cushioned shoe. Flatter arch, you do want a little bit more arch support in there. And those are kind of the low-hanging fruit examples for footwear. So next time you get out of the shower, put your foot down on that bath mat, kind of see where you are on the spectrum, and then you can use these suggestions to start getting ideas for what shoe might be best for you. Orthoses are another kind of hot topic with plantar fasciitis and really PT in general. So what the research kind of bears out is some people say a custom might be a little bit better. Some research says that there's no real difference between the two. Since that's the case, my recommendation would be start with the over-the-counter. You're going to be able to find them a lot easier. You can find them in most drugstores like Walgreens or CVS or Amazon. Like you can find everything in the world now. A few considerations for that. Dr. Scholes makes the plantar fasciitis specific one. It's actually pretty good as far as giving some heel support and some gentle arch support and cushioning. What I do want to advise you against is be wary not to get a gel heel. And the reason for that, gel, it sounds squishy, it sounds great, right? My heel is on fire, why wouldn't I want gel under there helping it out? But the gel actually deforms too quickly. So whenever you're running and your heel hits the ground, that gel is going to deform very rapidly, and it's still going to transfer the stress to the plantar fascia. So some heel support is good, some heel cushioning is good, but I would advise you against getting the gel cup or the gel heel cup specifically. Let's say you've tried the over-the-counter for a little while and it doesn't really seem to be working for you. You might want to try a custom orthotic or custom orthoses. And there are some great physical therapists in the area who can fabricate those for you. I think that's much more effective than just sticking your foot in the box and then having somebody send it off to a factory. If we have more questions about that at the end, I definitely have recommendations for that. So let's say up to this point, you've tried everything. You've tried to stop or decrease your training. You haven't been walking around in bare feet. You haven't been wearing sandals a lot. You've been stretching really diligently. Your significant other is finally accepting of that hideous night splint that you've been wearing to bed every night, and you're just still having trouble, right? So then it might be time to seek help. And physical therapists are really good at treating plantar fasciitis, and there's a few things that they can do that are difficult, if not impossible, for you to do at home. So a real effective treatment is joint and soft tissue mobilization. So what I have here in this picture is myself performing a mobilization on on a patient and just helping to get that dorsiflexion range of motion. It can work on the joints, the soft tissues, the muscles. There's various techniques that can be employed to really improve the motion there and help to take stress off the plantar fascia. Low dye taping has been shown in the research to have great immediate pain relief. That's a technique that a physical therapist can do for you also. And then probably the most important is you can get an advanced assessment. So maybe you have a kind of an idea of what size your arch is or what shape it is, and you think you might know what shoes are best. Physical therapists can really look at all the joints, especially through your lower body, from your hips to your knees and your ankles and toes, and really develop a specific program that's going to target the areas that are going to be most meaningful for you. And then also importantly, there's some other conditions that can kind of seem like plantar fasciitis, but are not. So some lumbar spine pain can refer down to the feet. And there's some nerve entrapments in the legs that can kind of mimic plantar fasciitis. So they can also help just to make sure that is what you're dealing with. And if it is indeed something else, they can help you get the other thing treated as well. So the clinical course, what you can expect for how long is this going to last? If you catch it right at the beginning and you employ some smart treatments, you don't overdo it. I have seen it resolve in weeks to months. Weeks is probably on the really optimistic end, but a couple months this thing can resolve, especially if it's not too irritated, not too severe. If you do develop into a chronic position, the pain's lasting more than about 3 months, you might expect that you're in for a bit of a battle, and you might need to seek some extra help to get to turn the corner with this. That plantar fascia has really poor blood flow, and it's consistent micro tearing of those fibers in the fascia can lead to longer recovery times. But the good news is the vast majority of people do find relief after about 12 or so months, and that's on the long end. So if you've been dealing with this for a while and you're kind of nervous about, am I ever going to be able to run or hike or walk again? The chances are good for that, but just be smart and try some of these tactics on your own or seek help. So I know I have some runners in the audience, and I just wanted to touch briefly on plantar fasciitis and running. So some runners with real, mild cases of plantar fasciitis can get away with still running a bit. I understand it's a lot of people's mental health, and especially during a pandemic and what everybody's going through, we want you to be active and getting out there. So just decreasing the intensity and the duration of it, while you're dealing with this might help take enough of the pressure off. One thing that you might consider is increasing the stride frequency of your running. So by essentially taking, more steps or a higher cadence, you're not going to be extending the leg as much, and you're going to be decreasing a little bit of the range of motion demands on those areas that can kind of bother the plantar fascia. Now, if you do experience true worsening, and how I define that is if the activity you're doing, it considerably worsens your pain, and it doesn't resolve quickly when you stop the activity, that means that the tissues, it's just being overloaded and it's not going to be able to handle it at that point. That's when I think it's time to get seen and get some help on how you can get back to running the fastest. So everybody knows the quote, but an ounce of prevention is worth a pound of cure. So the best way to treat plantar fasciitis is to not get it in the first place. And I just included a few thoughts here. Let's say you're listening in and you haven't developed plantar fasciitis or used to have it and you hope never to get it again. Really, again, the most important thing is to really gradually increase your training. If training seems like a strange word to you and you're just like, man, I want to walk, gradually increase your walking. After a period of inactivity, let's say you've been quarantined, you've been hunkering down for a few months, and then you're starting your health kick and you really want to get moving, just start slowly. A good rule in general is the 10% rule. So you don't want to add more than 10% distance per week. So let's say you can run a half mile or a mile, and you do that a couple of times this week, and then you just want to add about 10% onto that the following week. It's going to seem kind of slow in the beginning, but especially if you're coming off a layoff, you really want to work into it and feel good as you're exercising and not put yourself behind the eight ball right away. So the key points, just wanted to review here. First, I hope now you can identify plantar fasciitis. I want you to feel confident knowing that the signs of it that you might have would be that first step pain in the morning, kind of the inside of the heel under the arch of the foot. I hope number two, you can recognize how to start putting out the fire if you're dealing with it right now. Using that water bottle or the night splint can really help to start decrease the symptoms. For treating yourself, we went over some ideas for stretching, some considerations for shoe wear, and inserts that might help you. And knowing just when it's time to seek either a PT or seek a medical provider, your physician. Just if you've been trying this on your own, you've tried the strategies here, you've tried some things on the internet, and it's just not working out. This is really a better condition to kind of start treating sooner than later to get you recovering faster. And finally, number five, being active. As physical therapists, we all want you to be active. We want you to be healthy. If you're having foot pain, I hope this helps. And if you're a casual observer, I hope you kind of understand how some of these things that you can institute would keep you from getting plantar fasciitis in the first place. So we really want you to get moving, but just be smart about it and recognize those signs of when you might need to get seen. So I want to open it up to the chat box now, or you can unmic and interact personally, but what are the questions that we have?
Well, before too many people jump in there, let's get to the chat box. We had a couple of chat questions in there. The first one, first of all, thank you, Christopher. This is great information. And this is also probably the most well-attended Therapy Thursday we've had. So that's awesome. Thank you, everybody, for being here. All right, so the first question that came up was, are there any benefit to things that we've seen or heard, like scrunching a towel with your toes or picking up a marble with your toes? So I'm really referring to working those intrinsics of the foot.
Yeah, and so in a 30-minute presentation, you can't tackle everything, but I think the most benefit for those types of activities would really be for prevention. So if you don't yet have plantar fasciitis, working those intrinsics in your feet, it can kind of help support the arch. It's another dynamic support for arch there. So it can certainly be helpful in the prevention way. I don't think there's anything wrong doing it once you have plantar fasciitis. The evidential support for it is pretty weak, meaning that if you're going to have a program that involved intrinsic foot strengthening versus one that didn't, they haven't really demonstrated that that's a key part of the recovery. I'm a fan of doing everything that you think can be helpful. So I certainly think it's worth doing. If you only have 5 minutes to do your exercises every day, I think the stretching is probably the most important. But working those foot intrinsics can certainly help with arch support. I hope that's helpful. Let's see what other questions are in here. So Lori asked, should you continue to stretch if it hurts? You feel pain and burning in your arch when you do calf stretches, especially after sitting for a while. Also, it's so bad I'm not able to run without pain. Yes, if it's hurting so bad you can't run without pain, it's time to take a break and to either seek some treatment or try some of these things at home. If it hurts so much that you're stretching, some things that you can do to try to alleviate that are you can try these stretches with shoes on. So that's going to put your foot in a little bit more of a favorable position to get a stretch without causing the pain. And you can also consider having a bit of a heel. Make sure. Okay. Are we still on? Can people still hear me? Okay, good. So I'm sorry, Lori, let me get back up to your question. I just saw something that indicated we might not be on, but we are. Okay. So yeah, if it hurts so much that you're stretching, wearing shoes while you stretch, you can put a little bit of a pad under your heel as you stretch. And then I guess a follow-up question for you would be, where does it hurt when you stretch? If it hurts in your plantar fascia, then you might just want to decrease the intensity with what you're stretching. So I should have mentioned this with the stretching, but when you are stretching, you should feel a sensation of stretching. If you're stretching so much to the point of pain, that's too far. And if it's any amount of stretching is like it's on fire, then you might want to start with the putting out the fire options like just starting with the night splint and the iced water bottle just to decrease the symptoms a little bit, and then see if the stretching is more tolerable. Okay. And then Lori also asked, for nighttime, is the sock or splint better? I have had better results with the splint. I think it gives a more aggressive dorsiflexion. But if anybody has tried the sock and it's worked wonders for them, feel free to chime in. Personally, in my experience, I think the splint is better. And Shelby, good to see you, Shelby. Shelby asks, what suggestions for alternate exercises besides running while trying to cure PF, plantar fasciitis? Yeah, so anything that's non-weight bearing, that's not going to put as much stress through the plantar fascia. Some people can get away with biking, especially if you have kind of a padded supportive shoe and you're okay doing a flat foot on the pedal. If you have pedals that lock in and you're really on your toes, that might cause a little bit more stress. Swimming, if you have access to a pool. Trying to think of anything else off the top of my head, non-weight bearing wise. Anything that's just not going to put as much stress bearing weight through the foot there is going to be a good alternative for exercise while you're trying to get this thing taken care of. All right. And then Peter said, had the 10x procedure done on the tendon and finally cleared it off. Yeah, so Peter, that's a good point. Usually this can be handled with conservative treatment, but it can get to a point where it gets super chronic and you need to do some other medical procedures, definitely outside of my scope of expertise, but thanks for sharing that. Abra? Let's see here. Says, does plantar fasciitis have any relation to bunions on the big toe? And how would you adjust treatment and prevention? I don't know that it specifically has relation. You could certainly have bunions and have plantar fasciitis. Bunions, I'm just going to be perfectly honest, I'm not as technically versed in bunions and treatments for them. But I can say getting a wider toe box in your shoes is going to give more room for the bunions. And especially if you have a rigid foot, that wider toe box can give your foot a little bit more room to move in the shoe and could potentially have some positive carryover to plantar fasciitis. I don't want to make anything up though. I don't think bunions and plantar fasciitis are directly related, but I'm not sure the exact cause or treatment for bunions. Otherwise, adjustments for treatment or prevention, letting your symptoms be your guide. If a stretch hurts your bunion or a stretch is uncomfortable, just modifying it in a way that you get a good stretch in your calf or your plantar fascia and you're not bothering the bunion. Kathy says she was giving something that looks like half a wheel years ago, pro stretch. Now my husband has plantar fasciitis. Would this be a good idea for him to use? So I think that's probably a massager for the bottom part of the foot to kind of roll that tissue out. If you're going to use something like that, I would stick your foot in some, a bath or a bucket of warm water for 5 to 10 minutes to really loosen that up. That's just another way to kind of get the stretches more pliable. I think it would definitely be okay to try that. Just keep in mind that definition of true worsening. Anything you do makes it a lot worse while you're doing it, and it remains worse after you stop the activity. It's too much for that tissue to handle. Otherwise, Kathy, I think that sounds like an okay thing to try. But the stretching is going to get them out of the woods the best.
Christopher, I think what she might be referring to is kind of the rocker stretcher that has the dome on the bottom.
Oh, I don't have any experience with that. Do you, Evan?
I think it's a specialty tool that can help to stretch the calf. It's definitely a good tool. I think you can kind of get the same effect from doing the stretches that you were talking about before, or even kind of standing on the edge of a stair and dropping your heel down. For those who aren't familiar, if it Christopher, if you could unshare
yes
your screen. So I think that's kind of what
Oh, yes.
one of those guys.
Yep.
So I mean, it's a fairly good tool. It's very, you know, it's a one-trick pony. So,
Okay. Well, if you already have it, Kathy, you can try it out. Okay. Jeff asked, in addition to symptoms you described, I have pain on the upper part of the foot and also some swelling. Is that plantar fasciitis? So I hesitate to diagnose anybody through a chat box, but if you have symptoms similar to what I've described on the upper part of the foot, I think that would be worth getting somebody to look at it. I hesitate to take a stab at that without really seeing you, but if you want to shoot me an email or talk after, I'll happy to talk more about it. Kathy replied. Okay, that looks like the questions from the chat box. Does anybody have any live questions they want to jump on the mic for?
yeah, I think we're coming up on the end of our time here anyhow. But if you do have any other questions, I'm going to keep this chat room open probably for another 15, 20 minutes or so, just in case anybody has any parting shots they want to get in there for Christopher. But I dropped a couple of web addresses in there. So I will have all of this posted up on YouTube later today. If anybody wants to, if they missed anything or they want to watch it again. So you can watch it and subscribe to our YouTube channel. Also, if you haven't already, if you want to go onto our Facebook page, and sign up there, you can find out about more Therapy Thursdays coming up. And I will also post the links in there. Our next Therapy Thursday will be coming up in 2 weeks. Where are we? Hold up. Share content. There it is. So the next one's going to be in 2 weeks from today, November 5th. We will all be in the midst of our election hangover at that point, so you'll have plenty to either celebrate or commiserate on Thursday and at lunchtime. So we're going to be talking about balance, in the balance. So Kristen, who is a physical therapist here with us, will be talking about as we're getting older or just having balance issues in general, kind of what it may mean and how to address it. So it'll be back at that same link that you had today. It'll be the same one for next time, and every Therapy Thursday. And I think with that, that might be it for today. If anybody has any other questions, if you haven't put your email in the chat area to get the slides, please do so, and I will send that out later today. I apologize, my computer died right in the middle of Christopher talking before, and I thought I lost all of you, but it turns out that it kept on going without me. So, so that was good. So if you put your email in there, I may have missed it from before. So I think I got everybody's, but if you're uncertain that I got it, just drop it in again. I won't send it to you twice. All right. Anybody have any other questions for us for today? Just move this so I can see the chat. No, I think that's about it. All right. Well, I'll hang out here for a moment and I'll keep that chat box open until everybody leaves. But have a wonderful day. Thank you, Christopher. And we'll see you in a couple of weeks. So thanks, everybody.
Thanks, everybody. Thank you for coming.